19 steroid with the OH group in the 17th position. Synthesis of testosterone occurs from the cholesterol in the Leydig cells and is also formed from the androstenedione secreted by the adrenal cortex. Testosterone secretion occurs at the rate of 4 to 9 milligrams per day in normal adult males. Small amount of testosterone are also secreted in females. The secretion is under the control of luteinizing hormone. Almost 98% of the testosterone in the plasma is bound to plasma protein, and 65% is bound to beta globulin called gonadal steroid binding globulin or sex binding globulin, and 33% is bound to albumin. Mechanism of action of testosterone. Testosterone has several target cells. In the target cells of prostate, seminal vesicles, epididymis, penis, and skin, testosterone crosses the cell membrane and is converted to dihydrotestosterone by an enzyme 5-alpha reductase. In these cells, the dihydrotestosterone is the final hormone, and testosterone in these cells merely a prohormone. In the hypothalamus, muscle mass, anti-reputatory, testosterone is the final active agent and no dihydrotestosterone is formed. The androgen, either dihydrotestosterone or testosterone itself, depending on the tissue, combines with its receptor and the receptor loses its heat shock protein. Now the androgen receptor complex moves to the target chromosome and various proteins are synthesized and acts on target cells. Their actions on the sex organ or secondary sex characteristics and sex behavior in the fetus. Testosterone is formed in the 7th week of intrauterine life and it is responsible for the sex differentiation in male fetus. Exposure of some part of brain to the testosterone in the fetal life determines the sexual behavior in adult life. In the puberty, testosterone causes growth of external genitalia and accessory sex organs in the pubertal stage. Testosterone also causes appearance of secondary sexual characters in boys, that is, appearance of the beard, mustache, hairs on the chest and abdomen, as well as axillary and pubic hairs. The linear growth, muscular growth, deepening of the voice, and male cycle are also caused by testosterone. In adults, it is important for maintenance for accessory sex organs and it is important for development of the sebaceous glands and acne vulgaris. It is necessary for spermatogenesis and sperm motility. On the metabolism, it has mainly the anabolic effects. On the proteins, it increases the synthesis and increase the breakdown of the and decrease the breakdown of the protein, leading to an increase in the rate of growth. And in the bone, it causes epiphysis to fuse with long bone, and it also increases the growth. It also favors the calcium deposition, and it also promotes the growth of the muscle mass, and muscle mass gets doubled. It also has action on the electrolytes where it causes retention of sodium, potassium, calcium, water, phosphate, and sulfates. Androgenic drugs like nandrolone are used as anabolic steroids. These agents are not easily converted to dihydrotestosterone, so they have a minimal action on sex organs, but they act on muscles to increase the muscle bulk and strength. Unscrupulous sports persons misuse this drug to increase their muscular efficiency and it is called as doping. Coming to the regulation of secretion of testosterone. Secretion of testosterone from Leydig cells during fetal stage is caused by human chorionic gonadotropin from placenta. After birth, its secretion is absent till adolescence, and during adolescence, it starts again under the influence of gonadotropin releasing hormone. So gonadotropin releasing hormone leads to the secretion of LH from the anterior pituitary, LH is going to act on the interstitial cells of lady to produce testosterone, and the plasma levels of testosterone by negative feedback, it reduces the secretion of LH and GnRH from the hypothalamus. Some of the applied aspects related to male reproductive system. Cryptorchidism. The testis develops in the abdominal cavity and migrate to the scrotum during fetal development in the 7th week. The failure of descent of testis cause testis to remain in the abdominal cavity or inguinal canal, leading to sterility called as cryptorchidism. Testicular feminizing syndrome. It occurs due to the congenital lack of androgen receptors. Testis and testosterone secretion is normal, but testosterone cannot act due to the lack of receptors. So there is development of female genitalia and there is no enlargement of breast. Some of the tests which are done to test the male infertility. Semen analysis. Here the masturbation, a sample of semen is obtained and examined for sperm morphology, motility and count. Normally the volume of an ejaculate is 2 to 6 ml. If analyzed within an hour of ejaculation, more than 60% of the sperm should be normal in morphology, more than 60% of the sperm should be motile, and the sperm number in the ejaculate should be more than 60 million. At a testicular level, the function may be assessed by measuring the testosterone levels, that is free and protein bound testosterone. Sex hormone binding globulin may be measured in abnormal testosterone